process of filling those vacancies. And as I mentioned, we monitor the system on a regular basis, from our HR to our associate superintendents to myself. We start often our first call in the morning with understanding where we are with our COVID kind of related situation. But this year, we've worked really hard to proactively support our substitutes and our teachers union by increasing the rate of pay for our substitute teachers. So in Minneapolis Public Schools, we had almost a 20% increase for our substitute teacher pay. And right now the rates are ranging anywhere from $192 to $216 for a substitute teacher in Minneapolis Public Schools, depending on your position and the duration of which you'll be working in our district. We also took the step of allocating a full-time substitute at 30 of our sites we identified as having the greatest need in terms of filling vacancies. And so that's a full-time position allocated to 30 of our schools where they had the greatest need, so they could rely on having a consistent sub there. In some cases, obviously, they need more than one substitute, but that is just a step we took to ensure that they have that consistency. So after we use our available subs in our system, the pool of subs have been depleted and exhausted from our system. We then fill our openings with what's available at the site. I mentioned that there's a full-time sub at 30 of our schools, so they would access that substitute in some cases. We also have licensed staff who do not have full-time caseloads that with students that operate in the building. You may be aware that this year in Minneapolis Public Schools, we hired positions for literacy coaches in every one of our elementary schools. And so that would be an example of if we were not able to fill the substitute position, we would take that individual, shift them over to supporting the school needs for filling that vacancy. So that's an example there of how we would operate at the school level. In the event the school did not have any more options with their given staff, their licensed staff, then we would look to support from our district central office for those individuals who hold a teaching license. And I can tell you, leading up to break, we had a situation where we had a school that was not able to fill a couple of vacancies, but one in particular was a licensed math teacher. Consistently having a licensed math teacher was not possible based on the workforce shortage that we had in Minneapolis, as well as the shortage that exists across all the educational systems across the country right now. So what we did is we took a licensed math person who was a key position we had at central office, and we redeployed that individual to work at the school for a number of weeks so that they could consistently have a licensed teacher in their classroom. And of course, this has an impact on our system at large because this individual's job was to help facilitate our math adoption process we're going through. But we ultimately had to make the decision, in order to keep our students learning and keep things progressing in the classroom, we made that decision. So that does happen as well once we're not able to fill those positions in the schools with what's available in the class. In the school, we do use central office staff to support. So I guess some other points to just consider that, the teacher absences are not only, they're not the only stressors we're facing. I mentioned earlier the support staff and how critical they are to our work as a district to operationalize things in the district, from our food service to our custodians to our support staff who are providing that very needed assistance to the classroom teachers. We're challenged as an organization with our workforce development across the system, and we've been experiencing that for many months now. What we have done to address some of that is we've changed kind of our approach to our hiring process. We've done drive-through job fairs. As I mentioned already, we've increased kind of our substitute pay. We've been in negotiations with a lot of our bargaining groups, really trying to address the compensation and salary benefits for those individuals to entice more people to join the profession, to fill the void and the gap that we have right now. And ultimately, our goal is to ensure that all of our students have access to high quality instruction in school, and certainly with a licensed teacher, and that they can receive their instruction in the best and safest way possible. So looking at what we're doing when we get to that point of the COVID-19 challenges are too much, there are a number of factors that we look at before we can determine that we should be moving to distance learning. And ultimately, we're balancing the need to keep our students safe while also ensuring that they're learning, and making their learning space and environment what they need to be successful. I will say that every situation in every school is different based on a number of factors. Some of the things that we consider, one would be the number of positive cases that we have within a school, the number of quarantines that have to occur, whether that's a classroom quarantine or across grade levels or across the school. We also look at the cross-pollination of cases. It's definitely more complex in a high school because you have students and their schedules that are moving on a regular basis. We also look to determine if we can attribute the spread to a specific event. Many times it's cases outside of the school where these things are found. COVID is determined, whether that's through a gathering, a social gathering outside of school, or a public event that someone attended. So we really look for that information to help us determine how we can respond. The pace of the cases and how they're being processed is another consideration. If we've got an extreme number of cases coming through, working with our Minneapolis Health Department to determine, just how complex and how rapid those are coming in, that has an impact on our ability to maintain in-person learning. And as I mentioned, we have our health services department in Minneapolis that we work very closely with, as well as our regional support team. And so we have ongoing conversations about the latest information that's coming from the CDC or from the Minnesota Department of Health, and then just looking at the demographics and the case trends in Minneapolis. So all of those things are considered, as well as the impact on instruction, our ability to maximize consistent instruction with a licensed teacher, and of course the vaccination of status of our students in promoting and encouraging as many opportunities as possible for our students to access those vaccines that are out there. And if they've been vaccinated, knowing that earlier today, I think the FDA authorized the use of Pfizer's COVID-19 booster shot for kids 12 and older. So definitely we'll be promoting that information, sharing that information with families. And we'll do our best to provide those opportunities for vaccination clinics. We have partnered successfully with a number of organizations to be able to provide vaccination opportunities for our students and certainly our staff. We do have practices in place already with our staff to ensure that they get access to vaccines. And if they aren't able to get vaccinated for different reasons, then we offer and expect them to be tested regularly and provide those options at all of our sites, and they can get that during the workday. So I know that was a lot of information, but wanted to try to cover kind of the range of what we're faced with. And I will just say, in conversations with my colleagues across the nation, I know this is an ongoing stressor, both the issue of COVID-19 and the impact that that's having on our educational outcomes for our students, our safety and mental health well-being for our students and staff, as well as just the challenges we're facing with the workforce shortage. It's not just education, it's many other organizations too that are wrestling with this, and we're doing our best to find that balance of educating our students, maintaining a safe learning and working environment. So with that, I'm happy to open it up to questions. Christina, I'll defer to you to see if you can manage some of the questions that might be coming through.
Great. And then if you have a question, please raise your hand and I will call on you through that. Looks like Lou is our first question. So Lou, go ahead.
Hi, good afternoon. I'm just trying to get a full sense here of if this 285 number is really typical or not. Is 285 I mean, are there usually less teachers absent on the first day back from winter break, or is this really about in the middle?
I think Lou, it's a great question, and I think it's hard to determine at this point because like what's typical anymore, we're in a pandemic. Obviously, we've been in this space for almost 2 years now. We know that we typically do see absences, either the day before we go on break or the day we come back from break. I mean, that's not uncommon to see those as being higher dates. I think the other challenge that we have is we have a number of unfilled positions too. And so trying to figure out, I've just mentioned the absences, but we also have unfilled positions. And so it's definitely a strain and a stressor on the system. I think that can be clearly stated with confidence. And so where that fits into what's normal, I think I gave those numbers to you earlier that our daily range for teacher absences is anywhere between 200 and 300 for 3,500 teachers that we have in the district. I would certainly say we're
this school year or any year.
I would just say, that's the daily range that we have. I mean, I don't know that you can go to any school year because our numbers have changed in terms of staff who we've had over the last several years too.
Okay,
so
well,
I think it's safe to say. I think it's safe to say that we're experiencing greater stress, this time than we have in the past. How we can quantify that, I think there's going to be a lot of variables there.
Sure.
But
just one last follow-up on that topic. Are the people, I mean, we're hearing from a lot of people that are, saying that this is a big deal, the number of teachers that are out today, and that it reflects, some people want distance learning if they don't have that option right now. I mean, is it an exaggeration that this is, that some people are very concerned about the number of teachers that are out there?
I think I kind of asked and answered, Lou. We've got a few other questions here. I don't think we can speculate on what other people find to be a crisis or an exaggeration. I mean, people are concerned, and we're trying to do that as best we can. I don't know how you can speculate about that.
Yeah, I mean, thank you for the question, Lou. I think there's obviously a concern that we're still operating in a pandemic, and we're trying to do the best, best we can, recognizing the balance of the educational needs, the emotional, mental health needs, the stability and consistency of providing, in-person learning for students and for families. For many families that you've heard of who want to go to distance learning, there are probably many families you're not hearing from who are appreciative that we have their students in school in a space where they're, engaging in very healthy, learning kind of options, and so many things come from being in person. So that is the constant balance and challenge that we have. And I certainly don't want to minimize or dismiss anyone's concern about how difficult this is, because we've all been experiencing it, not just in education, but the families in home and in their work environments as well. So do appreciate the concern. And again, we're just trying to be proactive in terms of how we support the system. Like I said, our plans for redeploying staff and for kind of making those adjustments and really working school by school and case by case, we're doing it around the clock. So thank you for your question.
Yes, thanks, Lou. If we could try to keep it to one question a person so we can try to get these last two in before ending this briefing. Kate, can you go next, please?
Thanks for taking my question. I'm hearing from teachers that they're having to cover for other classrooms or doing other teachers' jobs because of the sub shortage. There's just not enough substitute teachers to go around. Is that true? And can you talk about what that means right now for students, or what a teacher's day looks like if they are having to do multiple jobs to fill those absences?
Yeah, so I can go back to our process. So in the event that they're not able to get a substitute to fill a vacancy, then what we do is we work within the school structure. And in many cases, we have situations where staff who are licensed do not have a full-time caseload where they work with students. And so that can be the example I gave around our literacy coaches who are not assigned to a full caseload of students, but they work with staff and students. So they have a great deal of familiarity with the building and knowing some of the routines and practices and kind of the culture of the school. So those individuals would be pulled to provide support. And that would mean that they might have, spending time in one classroom for a period of a couple of hours. And then depending on what that substitute need is, they might transition to another classroom, or they could be there for the full day. If it's a regular grade level, they might just be in that class for the full day. There's also a possibility that they might have to cover during what's referred to as their prep time. So teachers do receive time during the day to plan and prepare, make contacts with families. And sometimes if those subs are not available and they've exhausted all of the full-time they've exhausted all of the licensed staff who don't have full-time caseloads availability to support, then teachers will step up and fill where they can. And they do obviously an amazing job of that. And I know that that's an extreme burden and stressor right now. And certainly looking at what options there are beyond this practice is difficult, because the alternative in some cases would be we would have to then shut down school and move to distance learning. And so that's something, as I mentioned earlier, we have to evaluate, the number of things we're considering before we make a shift like that. And again, this is not something that's taken lightly, and it's something that unfortunately has occurred since I've been in education, more than 30 years. These are practices that happen. It's just extremely exacerbated right now because of the timing of things with the pandemic, as well as the transition to, back from winter break. And as I mentioned, the different absences that we have.
Thank you, Superintendent, and thank you for your question, Kate. All right, we'll do Elizabeth and then Mara, and then we'll wrap up the media briefing. Elizabeth?
Thanks, Elizabeth from Shockman from NPR. I'm kind of wondering, I know, it sounds like you've been working really hard. You've got a lot of systems in place, and one of those is checking with local health experts and local public health teams about kind of where things are at in Hennepin County and what that means for your school and watching the spread. I think I'm basically asking you to kind of predict the future of what will happen in the next few weeks, which I know is impossible, but also is your job to kind of make plans for various scenarios. What will happen if this? What is the, what is the situation looking like with COVID spread in your area, and what does that mean for keeping kids in school?
Yeah, well, thank you for your interest in having me predict what's to come. I think I can say with 100% confidence that we will continue to be in this case of dealing with the pandemic for the rest of this school year. I've been hopeful that we would be down a different path at the start of this year, and that's just not the case. I mean, I want to be optimistic, I want to be hopeful, but realistically, this is not going to go away anytime soon. And you can see some of the challenges with just how things change on a regular basis, from the recommended guidelines or considerations to things, as well as the data, and where we are. Our case data in Minneapolis is roughly where it was around Thanksgiving in November, when you look at the case data per 10,000. So, but the new virus strain has changed things, and it's really made it difficult for people. We moved from fatigue to exhaustion, and unfortunately, that's not good when you're talking about having to support so many different people. The work that has been done in education is unprecedented. We're providing mental health support. We're providing health and wellness, from food, nutrition to social and academics on top of it, trying to fit all of that in. And we're doing it with a staff that is amazingly dedicated and extremely exhausted from this work that has been going on for many, many months now, and almost 2 years. So that's what I can tell you in terms of predictions, is that we'll be continuing to work through this for the next several months and through the rest of this school year. And just appreciate everyone's understanding that there is no easy answer. In fact, some would argue there is no right answer. As I mentioned already, for every person who says we need to be doing this, there's probably 2 or 3 other people who are not saying it, but believing we need to be doing something else. And so I'm very proud of our educators for what they've done, from our classroom teachers, our support staff, our bus drivers, our IT technicians, to our custodians, our culinary wellness people, to our building administrators, who have stepped up to be responsible and to say, we're going to do the best we can in spite of all the challenges and in spite of the confusion and chaos that others may be creating in these conversations. They're continuing to do what's in the best interest of students and still finding that delicate balance. And so I couldn't be more proud of them, and that's what I can tell you at this point. But thank you for your question.
That's helpful. And I know you sent an email in recent days to Minneapolis families, kind of reiterating the importance of getting tested and vaccinated, but also warning about the possibility of having to switch to distance learning. And I wonder if you have a sense of, even based on conversations with, I know you talk a lot with colleagues, even in other states, based on what they're experiencing. And I know that, the virus has tended to hit other states before us. And so we kind of get a preview. If you have any sense of what school closures might look like in January.
Yeah, I would say it's a hit and miss. When we belong to Council of Great City Schools organization, which is roughly the 100 largest districts in the nation, and had a communication exchange last week about where districts were, and I think I heard from 5 of my colleagues who were having to move toward distance learning, and it ranged from we're going to have 2 days of professional development, and then we'll have 3 days of distance learning, and then we'll be back to, we're going to have 1 day delay, and we'll be back for the remaining 4 days, to we're going to be out all week. But again, it's so situation specific, dependent upon the number of positive cases, the number of quarantines, who they have in terms of their staff available to support all of this work, as well as what is the impact to the families, which often doesn't get considered in these conversations, as we were processing it. So what does it mean to a family who is now having to go into quarantine with 2 days notice, or go into distance learning with 2 days notice, and their kids are under the age of 12? How do they support the supervision? And what does it mean for the meals that they're going to be getting or not getting? Or the coverage that they had before school and after school that they now may or may not have, and the transportation. So it's just extremely complex. And again, I think it just varies. I've talked to my colleagues across the state, and there's, again, they're dealing with different cases. The cases that we have in our city might be very different in greater Minnesota. And yet they're not wearing masks, and not having a mask mandate, or they don't have a testing requirement of their staff like we do. So I think when you look at our practice of what we've been doing, we've been very, very focused on trying to operate with the greatest number of mitigation strategies that we can. I know that they put out a list recently of all the different strategies that you could put in place to mitigate the spread of COVID-19, and I think we ticked the box on all of them. And certainly, more work to be done as we evaluate every day, but we're doing the best we can at this time and trying to find that delicate balance.
Thank you.
Thanks, Elizabeth. All right, we'll do one last question from Mara, and then we will be done for today. Mara?
Yeah, thanks for the opportunity. And I'll reiterate by saying I don't envy any of you guys as you have to navigate these decisions. I just have a quick question on quarantines, and if you expect any changes in quarantine protocol, and if there's any changes or different conversations about how teachers, facing all of these challenges, how teachers are then expected to reach and teach, a number of students in quarantine.
Yeah, so thanks for the question. I think the information that came from the CDC regarding quarantine and isolation is still being evaluated and reviewed. Certainly by us it is, because I've not heard directly from the Minnesota Department of Health what their interpretation of it means. And so we want to be mindful of evaluating that. There's also the realistic approach to how do you operationalize that, you know? How do you operationalize that for 36,000 students, and what does that look like if you're going to make a reduction to your quarantine protocol? We have done that. We moved ours obviously from 14 days to 10 days a while back, and after much discussion and consideration with our regional support team and evaluation of data and what would that mean, you know, in terms of our students getting greater access to learning in person versus the risk of you know, compromising the health and safety of students and staff. So want to be very intentional and thoughtful about it. And so we do have regular scheduled meetings with our regional support team. I believe there's a Minnesota Department of Health communication that's going to be happening, or at least a conversation that'll be happening this week with our nursing staff, and then certainly other leaders that we can kind of hear from them about what their take is on it. And then in terms of just the challenges with quarantining, again, knowing the stress and pressure that is already on our staff, we're trying to find that balance. So our staff have done an amazing job of putting information around lessons up on you know, Google Classroom for people to access when they have to quarantine. We're also looking at providing tutorial support, resources after, you know, hours as best as we can. We've done that to some degree in our elementary schools and our secondary schools. But just know that this is a constant challenge. You know, this is not a question of do we want to invest in these opportunities. It's having the people available to do the work is the challenge right now. If you gave me 100 licensed staff to add to our team here so that they could provide those supports of you know, learning during quarantining, we'd absolutely, you know, hire them and put them in place, but we just don't have that available. We have positions right now that we're unable to fill regular positions.
All right, great. Thank you all for being here. I really appreciate it. And like I said, I did record this meeting. So if you want a copy of that, please email me. I put my email in the chat. You can also find my email on the staff directory. But that concludes our media briefing for today. Thank you everyone for your time.
Thanks everyone. Just want to thank you for your thoughtful consideration of how this information gets put out there to families. We know this is top of mind for them, and we also know that this has been very difficult for everyone who's involved in these conversations. And so I appreciate you taking the time to ask questions and get the information out there. Certainly know that we're still working together and collaborating as best as we can to do what's best for our students, our staff, and our families. Thank you all.
Thanks everyone. Have a great day.